Okay, welcome everybody. We're going to go ahead and get started. We here at OHD are so excited to have the opportunity to partner with OSHA during the Safe+Sound event this week. And thank you all so much for tuning in. I'm Stephanie Lynch. I'm OHD's Industrial Hygiene Product Manager. I want to point out that we have everyone muted to limit the background noise. We do, however, have the chat feature enabled. And if you're joining us online via Zoom, so feel free to shoot us messages there and we'll get to them as soon as we can. I have Justin here monitoring this for me, safely distanced, of course. Wave hello, Justin.
Hi there.
Okay. So jumping right in, let's start with what may seem like a very simple question. What is a respirator? Because of the pandemic, there can be a lot of confusion about what a respirator really is. And a respirator is something that forms a tight seal against the skin. It's going to cover at least your nose and your mouth, and it's going to filter out certain airborne particles. There are air purifying respirators, which is going to include your filtering Facepiece respirators, your elastomeric half and full face respirators, and all of your powered air purifying respirators, your PAPRs. So as a note, there is a loose fitting version of a PAPR, but for our intents and purposes, we're just gonna brush over that one. That's not actually required to be fit tested. So these are listed across the top row, and there are air supplying respirators. And those are the first two on the bottom row here. There are also combination respirators that can be used as both air purifying and air supplying respirators. This is a resource from the CDC and NIOSH. And it's good to help distinguish the different types. And although you likely can't read this very well on your screen, the link is listed there. So when the slides go out later, everyone will be able to see. So another question that's kind of become more and more common in the days of COVID is, what is an N95? So the NIOSH Respiratory Protection Approval Regulation, which is 42 CFR 84, defines the term N95 to refer to a filter class, not to a respirator. However, filtering Facepiece respirators have an N95 class filter designation, and so many people refer to them and have come to know them all of these filtering Facepiece respirators as N95 respirators. So an FFR that filters out at least 95% of airborne particles during a worst case testing using a most penetrating size particle is given this N95 or this 95 rating. There are 9 classes of NIOSH approved particulate FFRs available. And so 95 is actually the minimal level of filtration that will be approved by NIOSH. That letter N goes with the N, R, and P designations, which refer to the filter's oil resistance. And I have those described in this table here. Also, unfortunately, due to COVID and the shortage that's been created by the pandemic on the filtering Facepiece respirators, particularly the N95s, most likely because of this blanket use of the term for filtering Facepiece respirators, it's become more common to see fake FFRs on the market. So this is another handy graphic from NIOSH that shows how the markings on a NIOSH approved filtering Facepiece respirator should look. If you also look at 3M has other helpful resources that can help you identify counterfeit versions of their masks, since they're a major manufacturer. Last little bit of clarification that has become relevant. A facial covering is not acting as a respirator. It's not necessary that a facial covering be tight fitting, and it's not meant to be filtering the air. It's acting as a barrier against the spread of your possible droplets. It does not need to be fit tested, nor would fit testing be effective for use on these facial coverings that we're now all wearing.
Dr. Lynch, we do have a question. Let's see, Justin, like the name. They've been seeing a lot of K95s lately. Is there is the K a designation for another country, or do you have any insight into that?
Yes, so the K is for those models out of Asia, maybe specifically China. And some are authentic and can be used, but it is more difficult to then identify which one of those are legitimate.
Okay.
Because of our.
Yeah, thank you.
Okay, so we're going to dive into some more further basics, getting into our real topic here, which is fit testing. So a fit test is the use of a protocol to either qualitatively or quantitatively evaluate the fit of a particular respirator on an individual. The purpose of a fit test is to identify the specific make, model, style, and size of a respirator that is best suited for each individual employee. Fit testing is an integral part of your respiratory protection program. It is not, however, all of your program, just for our own edification here. So why do we fit test? Of course, we all fit test to ensure that our employees are protected and also well-trained on the use of their respirator, but we are also regulated to do so. In the US, OSHA, who also is putting on Safe+Sound, requires fit testing, but several other national and international organizations require it also. So I have what is by no means an exhaustive list of a few of the regulations focused on fit testing that do require it. So as of April 8th, OSHA has issued temporary guidance that's suspending the annual requirement to fit test for the workplaces that OSHA covers. This is meant to alleviate any of the strain that's been placed on employers as a result of the pandemic. This is because of things like shortage or personnel now being required to work from home, which could include your occupational health person or could include some of the employees who are coming up due for fit testing. It is not meant to prevent annual fit testing. If you can safely and effectively complete your annual fit testing, then you should. You're required to put forth good faith efforts to comply with this regulation. It also doesn't mean that your program, your respiratory protection program, is on pause. If COVID has impacted your ability to perform your annual fit testing, then this may be a good time to look at some of the other aspects of your program, like the required annual review. It can also mean diving into the usage or distribution, anything that impacts your respiratory protection program. You can start doing a little bit more of a deep dive into those things. And you can perform a lot of those activities even if you yourself are working from home. So with these COVID considerations in mind, we want to cover what are the more general requirements of the OSHA fit testing standard. Respirator fit testing needs to be performed initially, and that has not been suspended by the COVID April 8th temporary suspension of annual fit testing. Your initial fit testing is still supposed to take place, and that's going to happen before the person is ever going out and needing to use the respirator against a hazard. And you also want to implement fit testing anytime it's identified that an unfitted respirator is actively being used. So if you identify someone you weren't aware of who's using a respirator, they would need to go through an initial fit test. Repeat tests, as we mentioned, are going to take place at least annually, or if the user has had any facial changes, such as weight loss or gain, or any sort of facial surgery, including extensive dental work. This annual requirement it's the annual requirement that has been relaxed. And so your initial tests are still required. Just want to really put some emphasis on that. A medical clearance is also required before you're going to use a respirator. And COVID has introduced the need to do some sort of further health screening. So all possible fit testing participants should be screened for symptoms or any possible exposures. And if a participant self-reports any symptoms or exposure, then that fit test should not take place. That fit test should be postponed. So anyone who's either self-reporting an exposure to COVID or is having any symptoms whatsoever, that test should not take place. So an aspect of fit testing includes ensuring that your employees are properly trained on the use of their respiratory protection. This is going to include whatever hazards they may be protecting themselves from, and then also how to use their respirator, particularly the ability to put it on and take it off appropriately. Part of this is going to be performing a user seal check. So we've got the negative and positive pressure fit checks that you can do qualitatively, and also there's a new method, from OHD, where we have the QuantiCheck, where you can quantitatively perform that negative pressure user seal check on your respirator, and also then have a record of having done that. It can also be used as a really good training tool. So one type of fit testing is qualitative fit testing. It's a pass-fail method, and it's going to let you use your sense of taste or smell or your reaction to an irritant in order to detect leakage into the respirator facepiece. Qualitative fit testing doesn't measure an actual amount of leakage or do any ratio. It's all based on the subject's reaction or ability to taste or smell these substances. So whether the respirator passes or fails is just simply based on you detecting the leakage of that test substance, whether it's the irritant smoke that's going to cause an actual physical reaction, or you're tasting the bitter taste or the sweet taste, or smelling your banana oil. So those are the 4 qualitative test methods that are currently accepted. So qualitative fit testing is normally used for half-mask respirators, those that just cover your nose and your mouth. And half-mask respirators can be those filtering facepiece respirators, the FFRs that we've discussed, as well as your elastomeric half masks.
Dr. Lynch, going back, we have a couple questions regarding medical clearances.
Okay.
Can we tackle a couple of those real quick before we proceed? Is there anything on if medical exams need to be done after the initial medical exam? So say, for instance, someone that had a medical exam, but it was 20 plus years ago.
If it were me and it's 20 plus years ago, I would definitely think that there would be some changes in that health history, and I would redo your medical clearance. I'm not sure if OSHA has a requirement for how often you should do that, but I would assume that it's going to be at least any time that you would think changes had taken place. And for me, that would be on a regular interval. So
yeah, absolutely. That's great. And then, given just the COVID-19 pandemic, is there anything on if these medical evaluations can be done via like a telehealth type of thing, or?
Definitely. We're about to dive into kind of what your biggest risk right now is other people, right? So anytime you can limit that exposure to other people, then you're going to want to do that. And we'll kind of dive into that a little bit more, but yes, with regards to that medical clearance, most aspects of that would be able to be tackled via telehealth. Some instances wouldn't. Some special cases would require some in-person evaluation, maybe if it's having to do with lung function, if you've reported some issues there. But past that, a lot of these clearances could definitely take place online or via some telehealth. Second.
Perfect. Yeah. Thank you so much.
Okay. So now we're going to go on to quantitative fit testing. And quantitative fit testing uses a machine, and it's going to measure the actual amount of leakage into the facepiece, and it's not going to be dependent on the user's sense of taste, smell, or their irritation in order to detect that leakage. The respirators used during this type of fit testing are going to have either an adapter or a probe attached to the facepiece that will be connected to the machine by a hose. And there are currently 3 types of quantitative fit test methods that are accepted by OSHA. There's controlled negative pressure, which is the QuantiFit, OHD's instrument. Then we have ambient aerosol, which there are a couple brands of ambient aerosol, and then generated aerosol. Generated aerosol is usually uses a big chamber. They're not particularly portable, so you're not going to see them as much out, but they're used in research, a lot of different labs will have their own generated aerosol chamber, and there are some portable generated aerosol chambers. They're still rather cumbersome, but you just don't see them as much. So your fit factor, when you have a quantitative means of fit testing, it's going to provide you a fit factor. If you're doing the qualitative, then it's just a pass-fail, and we numerically call that the 100 pass, but it's just pass-fail. The quantitative means is going to provide you a fit factor based on leakage, and the 3 different types of technologies calculate the fit factor for each exercise, and a controlled negative pressure is going to have a different means of establishing that we'll roll into. And then they all do the overall fit factor with a harmonic mean, which we'll touch on a little bit later also. So the controlled negative pressure fit test method is going to convert the leak rate that it has measured into a fit factor. To do this, it takes a modeled breathing rate and then divides it by whatever measured leak it found. And this is how you get each individual exercise's fit factor. Another way to look at this is that it's the ratio of the total air inhaled to the possibly contaminated air inhaled. So with ambient aerosol, it's going to sample the ambient environment and the in-mask environment for these ambient aerosols, and it's going to create a ratio. It's the concentration of the particles outside of the mask divided by the particle concentration measured inside the mask. And so like I mentioned, once these individual exercise fit factors are found, then it's going to do an overall fit factor, and all of the methods do this overall fit factor. And it's going to do a harmonic mean that's going to establish that overall fit factor. So harmonic mean, fit factors are a ratio. So like we said with C&P, it's going to be that ratio of the total air inhaled to the contaminated air inhaled. And when you look at the ambient aerosol method, it's going to be the particles found outside the mask compared to the particle count inside the mask. And so ratios are numbers of the same kind, and they're used in mathematics to make it easier to know the value of one thing to another. And because fit factors are meant to be required to, or meant to be compared to a required pass level, which I don't even know if I've touched on when I breezed through that slide, but so your required fit factor for, let's go back to, your required fit factors for OSHA. If you're going to do a half mask, then it's at least a 100, and then your full mask, your full face respirator fit factor is going to need to be at least a 500. And I just breezed right past that one right there. Sorry about that, guys. But so when you do the harmonic mean, because these fit factors are meant to be compared back to that required pass value, this becomes very useful. And then also, because our average should be conservative from a health protection standpoint, it's useful to utilize specifically the harmonic mean as opposed to a straight average, because the harmonic mean is going to place greater weight on the lower values that are found. So this is just a quick example of the calculation of that overall fit factor. If you did a quick look at those numbers, the preliminary look would give you an average of 1,000. But the overall fit factor is only 862. And this is just to demonstrate that because of the use of that harmonic mean, as opposed to the straight average, it's going to allow fit factors to be more conservative in their estimation of your respirator's fit. So when we talk about these two different kinds of fit testing, you've got the qualitative and the quantitative. There's some differences in these methods. The qualitative is much less expensive, but it's only going to provide you that pass-fail value, typically used for half masks, and that's because of the required fit factor for full face going up to 500. They're going to be required to do quantitative fit testing that's going to give you that objective number. So these are just some of the differences. With qualitative, there is some chance for subjects to cheat. When I worked at a hospital, well, now quite some time ago, but when I worked at a hospital, we had a lot of people who knew that they had to pass their fit test to be able to perform the functions of their job. And, you know, they were highly motivated to get to work. So they knew the answers to our tests. We used qualitative in the hospital, and they would just go through, you know, yes, yes, I taste it for the sensitivity threshold. Then once you get your mask on, no, I don't taste it. And they just knew to say those things. So we had to actually implement a little bit of spot checking, where we would do things with the sensitivity test where you just use water, and if they say, oh yeah, I taste it, then you go, well, that would be impossible because it's not in there. So sometimes you have to get a little bit creative with your qualitative fit testing. Sometimes you have to get creative with your quantitative. So, just being flexible is really good when it comes to fit testing and your respiratory protection program in general. The two most common methods of quantitative, as I said, are the CMP and the ambient aerosol method. So controlled negative pressure is with the OHD QuantiFit, and this is going to use controlled negative pressure to directly measure respirator leakage. It precisely measures the leak rate in cc's per minute by determining the amount of air that leaks into the respirator during the test. So the OHD QuantiFit is utilizing air as the challenge agent. So ambient aerosol is carried out by probing the Facepiece and measurements of aerosol concentration under the mask and outside it. And it's the calculation of the ratio of these concentrations. You also have the ability to artificially create these aerosols if the natural particle count is too low in your test area. But so the ratio of the external particles to the particles within the respirator determines that fit factor. So with our COVID considerations for fit testing, the most important thing is to just have a plan. Take your time and really think about everything that's been impacted to allow yourself the ability to foresee some of the things that might happen, and then also give yourself some of that space for flexibility. We're all learning that this is an ever-changing situation, and we've all had to adapt. Well, it's the same with your fit testing. You're only going to want to perform those fit tests that are necessary. Like I mentioned before, your biggest concern right now is the exposure to other people. So you don't want anyone around other people who doesn't have to be. So it's a really important aspect of fit testing and this idea of risk to understand that because of how fit testing is performed, and all of the aspects that fall into fit testing too, the training, but because of how fit testing is performed with either without the filters in place or with a probed respirator, that respirator, the user is not being protected. And then because of how most respirators function, especially as you get into the elastomeric, they have an unfiltered free exhaust valve. And so the operator is not being protected. So you want to make sure that you're still implementing all of the practices that we know now. Allow yourself that safe distance. Use as open a space as possible. With the QuantiFit, you're going to be able to do that with air as the challenge agent. With ambient aerosol, it's going to be a little bit more difficult, but you're going to want to just use as open space as you can, as is possible. Open windows if you need to. Go outside, use a large open bay, and allow for that social distancing. Don't have people crowded in waiting for their fit test. Have allotted time slots that have just the one person coming up. And then also allow the physical distancing of the operator to that user. Keep in mind that you will still have to worry about your surface contaminant. Like we said, that exhaust valve is just free flowing. It's unfiltered air. And if you're assuming that every subject who comes up is possibly contaminated, possibly infected, which we have to assume in this new world we're living in, then you're still going to have to clean all of these common surfaces. So you've got the masks themselves, you've got the tubes, you've got your instrument, you've got any desk that was around. You may even want to change some practices. Maybe you used to have people come up and sign in to a sheet. That might not be a best practice right now, because now you're introducing something else that multiple people will have to come up and touch. Maybe previously you used to print off your fit test records and have someone sign right there. That might not be a best practice right now either. So you want to start really planning for what your situation looks like, and make sure that any time that people are able to, they're still doing all of the things that we know are best to do right now. Allow for that social distancing, wear a facial covering during the aspects of the training that you can, have a well-ventilated space, go outside if you can. Okay. So as far as cross-contamination, specifically with the QuantiFit, it's going to be very minimal. When you're talking about risk, as I've mentioned, and I'm sorry to just, keep repeating it, but it's so important. Your risk is the other people. And so because of how fit testing is performed with the QuantiFit, you're not going to have, you're going to have very, very, very minimal risk of any contaminant being somehow trapped and suspended inside of the tubing or adapters. The adapters don't hold air, and the tubes are going to be open to the air when the moment they're disconnected. So you're not going to have the chance of stuff floating around in there, and then subsequently the next person comes up, and that's not your big risk. Your big risk is that the other person is right there creating contaminant in the environment. So that's why you're going to want to clean the surfaces, and then also allow some time. So when a subject comes up and they go through their fit test, and they step away, like allow time for just the air to clear out, just give it a minute. So maybe right now with your fit testing, you had an expectation previously of how quickly you could get your test performed. That may not be the reality now. You're gonna have to, just give yourself the flexibility and allow for a little more time per test.
And Dr. Lewis, that's great. So I think that's a lot of the questions and concerns that we've been having is regarding cross-contamination specifically. So I think that's hitting hitting a nerve with a lot of people. So
Good.
That's great to cover that.
Okay, and just let us know if there's any further questions.
Absolutely.
Okay. Another important aspect of fit testing and for your respiratory protection program is record keeping. Luckily, if you're using any sort of quantitative method, these fit test reports are going to be created. Now this does kind of, with the COVID times, you're going to be in luck if you've got everyone already, preloaded. And then it's just going to be something you're going to have to work towards when you're having to enter people's information, how you're getting that information. And in my opinion, it would be, well beforehand, so you could already have them plugged in. So you're not having to go through these kind of questions and extend that time where it's maybe unnecessary.
And Dr. Lynch, we did have a question that popped up a couple times. Are there any special guidelines from employees with asthma, specifically to when they're doing fit testing and wearing a respirator? Do you have any insight into that?
That would be covered by, unfortunately, I'm not that kind of doctor, but that would be covered by that medical clearance for the initial use of their respirator, or if you haven't had that medical clearance, then you do need to go ahead and go through that. That is a critical aspect of respirator.
So it'd be a part of that process.
It would be
initially.
part of that process.
Okay, great, thank you.
Okay, well, that was our last thing on the record keeping. Do we have any questions, Justin?
We had a couple about ambient aerosol fit testing, specifically in regards to what is the cross-contamination risk there with CNC?
In all honesty, I'm not as familiar with the ambient aerosol method and what their risks may be, but I will say that your still greater risk is just this exposure to the other people. The person being fit tested is wearing a probed respirator. Those tubes do get some condensation, and because of how the ambient aerosol test is performed, the subject is more likely just breathing during the test, and there is going to be some interaction with the air in the tubes. But I'm sure that all of the manufacturers of ambient aerosol would have a document addressing this on their website. I would be shocked if they didn't. So I would just look for that with whoever your fit testing manufacturer is. I'm sure that they have some documentation on this.
Perfect. And then another question we got a couple times in regards to what exactly or what parts of the QuantiFit should be kind of wiped down and disinfected between each, fit test individual.
So when you're worried about just wiping down your equipment, you're only going to be worried about that external surface contaminant. And that may have been something I didn't state very clearly, because you do think about if an individual were to come up, we're assuming everyone's contaminated, they go through a fit test with the QuantiFit. In the unlikely event that some of their contaminated air were to somehow enter the machine, when you think about how you're performing a test with the QuantiFit, if you're familiar with the QuantiFit, then what happens is the subject's going to take a breath of what is room air, but we now know that the room air can't be considered clean per se, right? Because we're assuming everyone's contaminated, but you're bringing in room air that then's going to be pulled into the machine and exhausted. Well, any of that contaminant, when you think of these little viral particulates that are going to be in the air, I don't know that we know exactly how long. They say suspended in the free air, but when scientists talk about that, they're talking about in still air. When we exhaust the air from a mask for the test, it's getting pulled and just bounced around. It's in a very turbulent environment. So any contaminant that would be entering the machine, it's not likely to somehow stay suspended within the machine. It's likely to become impacted, which would then become surface contaminant inside the machine. Well, that's no longer a risk because no one's touching inside the machine. So what you want to worry about wiping down is making sure you're wiping down all of the external surfaces that someone else could come up and touch, including your fit test operator, who you of course want to protect. Now that creates a whole nother issue, which is up to the employer how far you want to go. But if it were me personally, if I were able to be comfortable with my exposure and know that I had not had an exposure and was confident that I did not have COVID and was not going to be spreading it, then I'm going to be in my full face respirator performing my fit test. And that's because my exposure is going to be the greatest with these multiple people coming up. And I'm also really bad about touching my eyes and my face. So that's just for me. And I'm going to have my P100 filters on my full face respirator. But each employer is going to have to come up with to what extent they want to protect their fit test operator. Gloves, what kind of facial covering are they going to be wearing? Are you just going to do facial covering? Are you taking it to the level of respirator? That all becomes dependent on your level of exposure and also your level of comfort with whether you yourself are creating contaminant. And I feel like I got way off track because I started talking about the respirator.
No, that's perfect.
Okay.
Do you have anything else, or?
I don't think so.
Okay.
I really appreciate everyone's time. And then also, we're going to have a recorded version out in the next few days.
Absolutely.
So everyone will have this. Each one of those slides where I used a resource, outside resource, I have the link on there. So you'll be able to access that and we'll have our contact information on there. If there's anything you need from me, my stuff will be on there and you can just let me know. And I just really appreciate everyone's time.
Absolutely.
Thank you, Justin.
Absolutely. And so to recap, we'll be sending out the actual PowerPoint slides deck on here, the actual recording of this webinar as well. And then I know we had a handful of questions that we didn't get to. We have saved the live chat in here. So we'll actually go back for the rest of this week and follow up with those individuals on a one-by-one basis to get those questions answered. So, but yeah, thank you all so much for joining us.